Hello and welcome to the program. Thank you for joining us. I'm Chris Oldcorn. Today we are going to see grim numbers on two accounts from the federal government. The first is the unemployment numbers are going to come out. In February, our unemployment was at 5.6%. We saw by mid-March that number had already jumped up to around 13%. And we'll now get a clear picture of how many people are unemployed when the March numbers come out later today. Also today will be the modeling from the federal government on how bad the coronavirus has hit Canada in terms of what are they expecting in terms of how many people are going to die, how many people are going to get it, and so on. Now, what we do know so far this week, the CERB, the Canadian Emergency Response Benefit, it opened up on Monday for you to be able to apply. And on Monday alone, now keep in mind that Monday was only for people born in January, February, or March. They had 966,000 applications. That's almost 1 million applications for people just born in the first 3 months of the year. Tuesday was for the next 3 months. Wednesday was for the next 3 months. And today, Thursday, it's the last 3 months. So if you were born in October, November, or December, you would be applying today. Now, what we do know is that 3.7 million people became eligible for employment insurance since March 15th. So since March 15th, not the beginning of March, but since the middle of the month of March. Now, a lot of those claims have been transferred over to the CERB benefit, so they get the CERB benefit first. It doesn't affect their unemployment in terms of how many weeks they're eligible. Their unemployment eligibility weeks will kick in after they've received the CERB benefit for the 4 months, unless their job comes back and they're able to go back to work. Now, the government is going to be giving us a model. Models are just basically predictions on sort of best case and worst case scenarios of how COVID-19 is going to affect Canadians in terms of how many do we expect that will be infected, how many people are going to pass away. So what we do know is that several provinces have already given us some projections. So this will help us kind of understand, where the federal numbers are coming from. Ontario has projected anywhere from 3,000 to 15,000 deaths from COVID-19. Quebec is looking anywhere between about 1,263 to 8,860. And then in Alberta, they have two different models. One is based on if people practice social distancing, the other is if they're not. Alberta has projected if they do social distancing, they expect a max of 3,100 deaths, but it could be as low as 400. That's if people social distance. If people don't social distance, they are predicting anywhere from 500 deaths to 6,600 deaths. So those numbers will inform the numbers that the federal government will be coming out with later today, giving us an idea of what the actual numbers will be for the entire country. Now, I want to talk about how Canada has responded to this virus. We have done a very good job. Both our federal and provincial governments have done a very good job in containing the virus. And I'm going to give you some stats to show you why. On the screen, you're going to see a chart. And I'm going to look at two different numbers on this chart. One is how many people per 100,000 have contracted COVID-19 and how many people per 100,000 have died because of it. Now, the United States is the global epicenter of the pandemic. They have almost 430,000 cases. But the interesting number here is that it's 131 people per 100,000. So out of every 100,000 people in their society, 131 have COVID-19. Now, at the very bottom of the graph, you're going to see Canada. In Canada, we have 19,274 cases as of yesterday. That's 52 cases per 100,000 people. We put in much stricter social distancing, stay-at-home orders, and so on than America did. They waited way too long to do those sorts of things, and now you can kind of see where we're at because of it. The U.S. has 131 people per 100,000. We have 52. We have less than half that they do, but we did it because we did the social distancing. We knew what to do based on looking at what was happening in Spain and Italy, that you had the social distance earlier. If you look at Spain and Italy, Spain has 317 people per 100,000, and Italy has 231 per 100,000. But look at the death rates. The States has 5 deaths per 100,000. We have 1 per 100,000. That is amazing. And the provincial and federal governments deserve big credit for that. If you look at Spain, they're at 32 per 100,000, and Italy is at 29 per 100,000. I just want to say something to everyone. Thank you for listening to the provincial and federal governments about staying home and staying socially distanced when you do go out, and to limit how many times you do go out. We are all in this together, and together we can beat this virus and return to normal life. But because we have made the sacrifices now to stay home, only to use essential services when needed, and only to have our essential workers working, we are able to contain this virus. You can see the difference between what has happened in the US compared to what has happened in Canada. So thank you to both Doug Ford and Trudeau. You guys have been, both of you and the people around you are doing a fantastic job, and I want to commend them both. But here's the thing. In the next segment, I'm going to talk about how one jail took 2 people and within 2 weeks had over 350 people infected with COVID-19, and how this could affect us if we get together at Easter with all our family, and then we travel around and then we travel home, and how the virus can spread. So I'm going to cover that in the next segment. I'll see you in a few moments.